In the last podcast, we raised the general issue of whether abortion is morally permissible in cases in which someone learns that her fetus has a debilitating disease like Tay-Sachs or spina bifida. From here, the issue becomes even more complicated. What about conditions that are considered disabilities but don't result in constant death or constant pain? So we saw like Down syndrome, cystic fibrosis. What about deafness? What about achondroplasia, an illness that results in dwarfism? In her article, Laura Purdy raises a related issue that moves us away from thinking about selective abortion for the time being. Then, what are the moral ramifications of choosing to have children when one knows that there is a likelihood that one's child will have a debilitating, disabling disease? Does one's autonomy and decisions about conception always trump the responsibility one has toward one's own potential offspring? Purdy's thesis is the following. It's a quote. My primary concern here is to argue that conception can sometimes be morally wrong on grounds of genetic risk, although this judgment will not apply to those who accept the moral legitimacy of abortion and are willing to employ prenatal screening and selective abortion. If my case is solid, then those who oppose abortion must be especially careful not to conceive in certain cases, as they are, of course, free to follow their conscience about abortion. The range of application in her paper, then, is not universal, though she might broaden her range even a bit more. After all, if someone thinks that, while selective abortion is not wrong in all cases, deciding to abort is still a grave decision, they may still hold that choosing not to conceive in these cases is morally incumbent upon them. So if we rule out selective abortion as an option, or treat it strictly as a last option, must we hold that it's wrong not to take measures of contraception in circumstances where someone is likely to conceive a child with a debilitating condition? Purdy thinks that cases of Tay-Sachs and spina bifida are too easy here. She considers a kind of condition that becomes manifest later in life than childhood, and the probability of which can only be partially determined. Huntington's disease. The symptoms of Huntington's disease become manifest between the ages of 30 and 50, and they generally are pretty extreme. We have a description that Purdy quotes. I'm going to present it here. So here's the description of Huntington's disease. Onset is insidious. Personality changes, obstinacy, moodiness, lack of initiative, frequently antedate or accompany the involuntary choreic movements. These usually appear first in the face, neck, and arms, and are jerky, irregular, and stretching character. Contractions of the facial muscles result in grimaces. Those of the respiratory muscles, lips, and tongue lead to hesitating, explosive speech. Irregular movements of the trunk are present. The gait is shuffling and dancing. Tendon reflexes are increased. Some patients display a fatuous euphoria. Others are spiteful, irascible, destructive, and violent. Paranoid reactions are common. Poverty of thought and impairment of attention, memory, and judgment occur. As the disease progresses, walking becomes impossible, swallowing difficult, and dementia profound. Suicide is not uncommon. This is an insidious disease indeed. What makes this a useful condition for our purposes is how it's transmitted. It's genetically passed on, and today carriers can be detected using genetic testing. So let's imagine a person, let's call her Nancy, who is considering having children. She can get tested to determine whether she is a carrier of the gene. Now, if she carries the gene, then she will contract the disease. Unfortunately, without testing, people usually don't even know they have the gene until they begin to experience symptoms in the middle of their adulthood, generally after childbearing years. Now, if Nancy has the gene, then there is a positive probability, 50%, that her offspring will have the gene. If she conceives without getting herself tested prior to conception, and doctors test the fetus for the gene, finding that the fetus has the gene, then she will have to choose whether to have the child, who will certainly contract Huntington's disease, or abort. But if Nancy is opposed to selective abortion, then she will have to have the child, knowing what is in store for him or her later in life. So the moral question is, to what extent is she morally responsible for the suffering of her child if she decides to have children? Notice that this is an issue only because Nancy is able to access the information about her own genetic status. If she was unable to know whether she had the gene, and even if one of her parents has or had Huntington's, this would imply that she had the gene. This wouldn't imply that she had the gene. It wouldn't be as morally significant. Of course, if she has even a remote suspicion that she has the gene, we might judge her morally culpable for her child's eventual contracting of the disease. But since she actually does have access to genetic testing, her decision not to get tested, or her decision to conceive after having gotten tested and found that she is a carrier, are within the realm of moral determination. So let's finalize the case. Nancy has gotten tested and is determined to have the Huntington's gene. Now, she is opposed to selective abortion, so if she conceives a fetus carrying a gene, she will refuse to abort the pregnancy. A fetus that has the gene will contract the fatal and debilitating disease in middle age. Recognizing that there is a chance that Nancy will not pass the gene on to the fetus, we can now ask whether it would be morally permitted for Nancy to conceive. Purdy thinks not. Nancy shouldn't conceive, she thinks, because of the suffering that is likely to result from this decision. Purdy thinks that parents have a duty to provide their children with a, quote, minimally satisfying life, unquote. In this context, she thinks that that means ensuring normal health for their children, since this is a prerequisite for a minimally satisfying life. Thus, since, or if, a life spent with symptoms of Huntington's disease is not a minimally satisfying life, a carrier of the gene should not conceive, since doing so might violate the parental duty. Now, Purdy considers an objection to her view, but we might raise some questions of our own. First, is it the case that contracting Huntington's at the age of 30 and dying at 45, as many people do, renders the entire life not minimally satisfying? Second, what is Nancy's moral status if she chooses to conceive and doesn't pass the gene on? Is it like cases in which someone does pass the gene on? This seems similar to drunk driving, when someone drives drunk and actually doesn't harm anyone. We might ask, was it okay that I drove drunk, given that I didn't hurt anyone? Is it okay if Nancy conceives and actually doesn't pass the gene on, even though she knows that there was a 50% risk of passing the gene on? Third, who exactly is it that stands to be harmed by Nancy's decision? If she decides to conceive and has a child who carries the gene, who develops into an adult who contracts the disease, then is it the child, the adult, or the person overall, from birth to death, who is harmed? But until Nancy conceives, there is no person to be harmed. So why should she choose not to conceive for the sake of a potential person, which is, after all, not a person at all? Now, the objection that Purdy considers is that everyone has the right to produce. So her claim that Nancy shouldn't conceive would just be a violation of that right, according to the objection. Purdy responds by asking just what goals people seek to accomplish in reproducing. Some of them, like the building of a family, can be met by alternative methods to straightforward conception. Those that cannot be met in this way, like wanting to see one's genetic line continue, or seeking immortality, or to produce children that resemble one, are, in certain circumstances, not morally worthwhile goals, she writes. Fortunately, further scrutiny of the situation reveals that there are good reasons why people should attempt, with appropriate social support, to talk themselves out of the desires in question or to consider novel ways of fulfilling them. Wanting to see the genetic line continued is not particularly rational when it brings a sinister legacy of illness and death. The desire for immortality cannot really be satisfied anyway, and people need to face the fact that what really matters is how they behave in their own lifetimes. And finally, the desire for children who physically resemble one is understandable, but basically narcissistic, and its fulfillment cannot be guaranteed even by normal reproduction. Purdy's conclusion, as we noted earlier, applies only to those people who refuse on moral grounds to abort pregnancies, even when there is a strong chance that the child will have a debilitating disease. Notice also that this applies only to those conditions, the likelihood of genetic transmission of which can be determined prior to conception. But given the fact that we can determine the chances of genetic transmission of certain conditions, Purdy thinks that we have the responsibility to know what these chances are and to decide accordingly. And I'll wait until classroom discussion for us to discuss whether we think Purdy is correct.